I'm Dr. Aswathy Sasidharan, consultant neurologist at MAS Medical College, Perindalmanna. On the occasion of National Epilepsy Day that we are observing on November 17th, I would like to share a few facts regarding the first aid of epilepsy. It's quite nerve-wracking for any one of us to witness a patient seizing. So now, what's a seizure? It's a brain disorder due to uncontrolled electrical discharges that are emitting from the brain. When you find a person seizing, you might find them with uncontrolled jerking movements of both the limbs, upper and lower limbs, or a loss of consciousness. They can drool out saliva. At times, it may be blood tinged from their mouth. They can be bowel or bladder incontinence, that is, uncontrolled of bladder or bowel. And after the whole episode, the patient might fall into a deep sleep or they might be confused. So, this is the episode what a seizure would be like. And now let's discuss something regarding how the first aid must be after a patient is seizing or during a patient is seizing. So, when you find someone seizing, the point number one to be taken care of is remove anything that is potentially hazardous from the nearby surroundings. Say, for example, any sharp objects or chairs. Be especially careful with cooking utensils or any uh, burning objects or something to remove or to avoid burns or scalds. Number two, expose their neck or remove any tight clothing around the neck. Now, point number three, their head or the surroundings of the head should be taken care of, like placing a soft or a pillow or a cloth nearby to avoid any injuries to their head. And don't restrain the patient from any sort of movements they are having. Do not restrain them. The seizure will cease on its own. And now make a note of the time when the event is starting and when the event is ceasing. Because if the event is exceeding more than, say, 5 minutes, it's like an indication to take the patient to hospital. And at times, your doctor might prescribe you some medications like nasal spray to be used in case of emergency. And you should use like a midazolam spray, and it should be used in the dose that is prescribed to you. And finally, when the event is over, you should make them lie in the lateral position. That is, you have to make the patient lie on their side. And at any cost, do not insert anything in their mouth. If say it is a medicine or any, don't try to poke your hands into their mouth. It might injure you as well as the patient. Don't administer anything into their mouth while the patient is seizing. Say it be drugs or water. Do not give anything until the event is over. Okay, so now these are few points that you have to be careful when you find a person seizing on the occasion of National Epilepsy Day. It is a day to create awareness and to eliminate the myths and taboo regarding epilepsy. So, proper first aid can dramatically reduce the panic or anxiety and ensure best possible care. So, my message for you today is that epilepsy, it is not scary if you are aware. Thank you so much for the patient listening.